How are you?
I'm good. How are you?
Good. So, we're going to talk about playing with Kate.
Okay.
You're at home playing with Kate and bringing some of the tools and techniques that we use in our playroom to yours.
Okay. Now, for at home with Kate, do I need to put a blanket down?
Well, you know what? We'll talk about that in just a second.
Okay.
It's one of the things of how to set up your play. One thing you definitely want to do is differentiate this play from other play that you do with Kate. So you're not going to be wanting to do this with board games. You're not going to be doing any kind of win-lose situations.
Why not?
You want this to be more Kate's way of expressing herself and directing the play. Following the rules is not really creative enough.
Okay.
And so we're going to go with a couple things, and I'm going to show you some different techniques. 3 things that you want to know. These are probably words that you've never heard of, or maybe you have. Some things called tracking, reflecting of feelings, and also limit setting.
Okay.
Alright? The first one, we'll talk about limit setting since you brought up the blanket. Is there anything that you don't feel comfortable with doing at home?
Well, I get nervous with breakables, with things around the house. I don't know if I would be comfortable with her breaking things.
Okay, that's definitely understandable.
Drawing on the walls.
Okay, so that's where the limit setting is going to come in place, and you asked about the blanket.
Okay.
Setting the limits, letting Kate know, this is the area that we play in. So it doesn't have to be a blanket, it could be just a special room, a spot where you're going to play. And what toys that you can use. If you're not comfortable with something breaking, you're not going to want to have those toys there accessible.
Okay.
In terms of drawing on the walls and things like that where you express concern, it's one of the rules that you'll set for the playtime.
Alright.
It's okay that we can color in this area, but we're not going to color on the walls. Okay? Do you have any questions so far?
So far, not right now.
One of the other things they mentioned is tracking.
Okay.
Tracking is a way of kind of staying in the moment, keeping up with Kate as she plays. So, it's going to sound a little bit like you're almost narrating what she's doing, but really what you're doing is you're letting Kate know that you're with her, and you're following her, and you're tracking with her.
Okay.
Okay?
So, what might that look like?
When we do a little role play,
Okay.
and we'll kind of like play that out and experience that, and I'll definitely show you what that looks like, so that you can actually do that with me.
Okay. That's right. I'm a little eager.
That's alright. And the last one is the reflections of feelings.
Okay.
Kind of, paying attention, keeping where Kate's at, and just kind of directing, like, what the feeling that she has. So, things like you seem, or you look like you're angry. You're not going to want to do that. You're going to be like, you're angry, and kind of be more definitive.
Okay.
Okay?
So it clarifies.
Absolutely.
It's not like a mixed message.
Right. It's more like a finite response to it. Alright. There have been a couple themes that Kate has brought up. And I just want to find out what your comfort level is with, Kate's level of aggression. It may be some play that you haven't seen before. So, if you see Kate being very aggressive, is that something that you're going to be comfortable with?
Well, I guess it might depend on what the context of the situation and what she might be aggressive towards. I might get a little uncomfortable if, for example, I see her, breaking heads off toys, or, doing very scary things. And perhaps sometimes, I'm not sure if I'm comfortable with her directing her anger towards me, because as a parent in that role, I'm not sure if I could let her act that out.
Okay. Well, the difference between this sort of play and play outside of this special time that you're going to have with Kate really comes down to, her expressing herself and her feelings. And this is how she kind of is going to communicate with us. Using these tools, like you said about breaking doll heads, are you more uncomfortable with the act of it or the doll breaking?
Probably the act of it.
Okay. This is going to be how Kate communicates her anger.
Okay.
I understand that, it's not necessarily the most comfortable thing in the world to see, your child is pulling heads off dolls. But it's going to be a way to communicate. It's her reaching out.
Okay. What about if she shows aggression towards herself?
Towards herself?
And it looks like she's doing something very dangerous or something very, I'm trying to find the word, say she puts a gun to her head.
Okay.
Or something like that.
Alright. That's going to fall under your limit settings.
Okay.
What you feel comfortable with and what you allow in your playtime.
Okay.
Whether she's harming you, you're probably going to want to set that limit to, you can't harm me, but you can, direct it towards a toy.
Okay.
Harm towards herself, just to give you an idea, if it's something soft and she's just hitting herself, that's fine. If it's something seriously that's at risk, she starts to press too hard, you're going to want to stop it before any sort of harm comes to her. Safety is always going to be a priority.
Sure. Okay. That makes sense.
Alright. So, do you have any questions with what we've gone over so far?
Not yet. This is good.
Okay.
This is good.
So, why don't we do a little role play?
Okay.
Kind of like bring these techniques together.
Sure.
One thing I definitely would suggest when you start talking with Kate, like I said, differentiating this time from other times that you play with Kate.
Okay.
So, sort of, making a special time. Because at the end, Kate's not going to be one to clean up.
Okay.
Okay? This is going to be something that you will do. When I play with Kate, it's something that I do.
So should I tell Kate, should we give this playtime a name?
Definitely.
Okay.
To differentiate that it's a special time, it's for special toys, it's a certain time that you have to bond with Kate.
Okay.
Alright?
Alright.
So, when you have your first meeting at home, you're going to want to let her know that this is a special time. She should be excited about it. So, have an open, greeting and dialogue with Kate, where you're going to sit down and be like, Kate, this is our special playtime. The toys that we have, you can do whatever you like, but there are certain rules, but if you break any of these rules, I will let you know.
Okay.
That's where you come into the writing on the wall, or, the hurting of other people. Okay? Why don't we start to play?
Okay.
And then I'll have you track, reflect feelings,
Okay.
that sort of thing.
Alright. Do you mind if maybe you show me what those look like, and then I can try?
Absolutely.
Okay.
Alright. So why don't you pick some toy
Okay.
and, just play with it, and I'll kind of just
Right.
demonstrate that for you.
Okay.
Michelle, you picked the bear.
Yes. His name is Ted.
You're playing with Ted?
Yes.
You're done with Ted. You found the helicopter. You're having fun flying the helicopter.
Oh no! It broke.
The helicopter broke?
What's this guy's name? They look like ninjas.
They look like ninjas? They're fighting.
So I see you kind of follow, if I
Right.
pick up something, you kind of let them know that you're paying attention to them. And with like the smiling, would that be an example of reflecting?
You would reflect on that smiling.
Reflecting, okay, I see.
What
Yeah.
that is. And I have to apologize, just made an error myself.
Oh.
I had said that you seem happy. It would
Oh.
be, you're happy they're fighting.
Okay. And of course that sounded so natural to me, so thank you for pointing that out.
So that's the differentiation between this play and other play.
Okay. I see.
You're playing with the ball. You're tossing the ball. Picked up a sword. Up. Now, Kate, I'm going to talk to you as your Kate.
Mhm.
One of the rules is that you can't harm me in any way.
Okay.
Okay?
I see.
So that's where you come back to your limit setting.
Right.
You know, every once in a while you might have to come back and just bring that back into the picture for Kate.
Okay.
Anywhere that safety is an issue.
Okay. Alright.
So are you ready to give it a try?
I think so.
Okay.
I want to see if I can pick it up
Alright.
and do it.
Well, I brought some toys that Kate likes to play with.
Okay.
So we're going to demonstrate some of those things that Kate is.
Sure.
Alright. So at this point, we would have had our little greeting.
Mhm.
Would have explained, you know, we can play however we like with the toys that we have. We've gone over your limits and things like that with Kate.
Okay.
So, are you ready to try?
Yes.
Alright.
Oh. You picked up the red Power Ranger. And the yellow one. Oh, you're making them fight. I see you're smiling. Oh, now you look angry. Are you okay?
You're not going to want to ask those kind of questions.
Oh, okay.
Okay?
I see.
You're going to still want to track, just kind of monitoring the motions of what Kate's doing.
Mhm.
So you'd be like, oh, you picked the Snoopy.
Oh, okay.
Okay?
Alright. Thank you. You have a knife. Oh, you're stabbing Snoopy. What if you stab, what if you stab something else, like the ground?
I'm going to stop you there.
Okay.
I understand where your concern might be with
Mhm.
the violence, but by suggesting something, you're being too directive with the play.
Oh, okay.
It's not necessarily being associated to, you know, Kate's free expression.
Okay. So I should let her play that out. Okay.
Yes.
I see. You have that mask or dental mask. You're tying up Snoopy with
It's a
that
bandage.
bandana. A bandage.
Yeah, Snoopy's hurt.
Snoopy is hurt. Oh, you're holding Snoopy, cradling him, rocking back and forth with Snoopy.
Excellent. Snoopy's going to go to the hospital.
Oh, Snoopy's going to the hospital.
Okay?
You grab that notebook there. The blue marker. You can draw. I see you drew a heart.
Mm-hmm.
Why did you draw a heart?
Stop you again. Questions that probe into the why, things like that. stay away from those.
Okay.
You're going to still be in the moment with the tracking, reflecting of the feelings,
Mhm.
but anything that's sort of directive or asking Kate to explain
Okay.
is not necessarily the techniques that we would use.
Okay. You drew a red circle. An orange one. Ah, crossing out the whole picture with a black marker. This is pretty.
One thing you're not going to want to do is compliment Kate.
Okay.
You draw very well. I understand as a parent it's very difficult to not want to compliment your child on, you know, a beautiful picture, but you're going to stay away from things. You draw well. Complimenting, like, that's a pretty picture. You know, you do that so nicely, you know, anything that's kind of that encouragement.
Okay.
Compliments are good, encouragement is what you want to do.
Okay.
Do you understand the difference there?
I think so. So, the difference, maybe I could say, you can really draw a picture. Something like that?
It's good, it's a good start.
Okay.
That's a beautiful picture, that's a beautiful tree, things like that. You draw trees very well.
Okay.
That
I
kind of
like, yeah,
difference.
I see. You draw a tree. Okay.
Okay? Things that you're going to want to look out for when you're playing with Kate, or things that you'll notice, are themes that really center around anger and aggression, and also themes that center around nurturing.
Okay.
Things like that is, I would really appreciate, you know, bringing back to when we discuss things, and, you know, how Kate plays at home.
Okay.
This way, you know, we can differentiate and see the differences in which way Kate plays between home and here in the playroom. And we can get a better understanding of where Kate's at.
Right. I see. I guess the few questions I have are, how long should this playtime with Kate be?
Okay, it's definitely a good question. That's one of those things that you'll address in your limit settings. To when you sit down with Kate, so this is going to be a special playtime where we'll play for 20 minutes, 30 minutes. I understand that you have a busy schedule, so consistency is definitely something you're going to want to adhere to.
Okay.
So if you are only available to play 30 minutes, you know, that's your time.
Okay.
And it should be at the same time on a weekly basis.
Weekly?
Yes, so that
Okay.
Kate has that expectation, she knows it's there. It also adds to the speciality of, you know, that time together.
Okay. Should it be once a week or twice a week?
How do you feel that what do you feel you can commit to?
That's a good question. I would like to do twice a week, but I don't know how consistent or...
Okay, if there's a question from that, once a week, stay with that.
Okay.
Okay, because she still will have her time here on a weekly basis, and she'll have her time at home.
Right. Now, what would happen, say we're in the middle of a session and someone rings the door or I get a phone call? Is it okay to stop and then come back and continue?
For the benefit of Kate, if you're able to, just ignore it.
Ignore it?
Yes.
Okay.
Stay in the moment with Kate, stay in the playtime with Kate, and follow up on those things afterwards.
So it's full commitment for the whole 30 minutes?
Absolutely.
Okay.
In the event of there's a fire in the house.
I see, yeah, in the case of emergency.
Yes.
I see. Safety.
Safety is one of your priorities.
Yes, safety is
But yes,
priority.
phones, leave them out of the room, sort of thing. This is a special bonding time and exploratory time for Kate.
Now, if I had any concerns or questions, would I be able to contact you?
Absolutely.
Okay.
You can call the office at any time, leave a message, and I'll get back to you to answer any questions that you may or may not have.
Okay. And with the training, would we still be able to do a play session with your supervision to kind of check in how we're doing?
Absolutely, we'll continue to do that and to continue to build on that.
Okay.
I know this is the first time that we're doing it, I'm not expecting you to go home and be ready to jump right in. We'll continue to model this and to, kind of demonstrate this with Kate. So we'll have you play with Kate in the playroom before you go home and do this, and
Okay.
and I'll be sitting in the room kind of to give you feedback and things like that.
Feedback. That sounds great.
Do you have any other questions?
I think that's good.
Okay. All right. So I guess what we'll do at this point, we'll grab Kate.
Okay.
You guys will be done for today, and the next time you come in, we'll start practicing with Kate.
Okay, that sounds good. Oh, I guess I should, this is kind of an important one I forgot to ask about, but sometimes it's a little hard to, if she's having fun or she's playing with toys, she has difficulties listening and stopping.
Okay.
So to end the session, should I have like a 5-minute warning or?
Absolutely. If you want to set that up with your limit settings,
Okay.
you'll let Kate know we only have 5 minutes left to play.
Okay.
We only have 3 minutes left to play.
Okay.
You're going to experience probably some resistance, so just be prepared for that.
Right.
But setting that limit, saying, okay, our special playtime is over, it's time to continue on.
Okay.
Definitely something we'll practice too while you're in the playroom with us.
Right. Okay. Thank you.
Oh, absolutely.
Well, it's very nice to meet you.
Nice meeting you.
All right.
That's good. Kate,